Hi, I decided to make this video about health insurance because in the United States there seemed to be a lot of controversy about health insurance. But here in Europe, where I live in the Netherlands, there is no controversy about health insurance. We all have health insurance and it's very, very affordable. And I'm going to explain a little bit about health insurance here. I live in the Netherlands, and each country in Europe have different systems. You've heard about the national health in Britain, where everyone gets free insurance, but in the Netherlands we don't have free insurance. Everyone has their own policy, and the policies are held by private insurance companies. So it's very similar, actually, to other capitalist countries. We are a very capitalist country. Some of the biggest corporations in the world, like Dutch Royal Shell, Philips, KLM, and many other companies, are from the Netherlands. And the Netherlands, of course, created the first corporation, the Dutch East India Company, a long time ago. That was a capitalist venture, to say the least. Here are some basic facts about health insurance in the Netherlands. And these facts apply to all insurance policies. The government actually controls many of these basic provisions in the policy. And you can see that you can't be denied coverage for pre existing. And for example, on the third line there, you see that if you have low income, the government will actually supplement your premium. All the visits to your personal physicians are free, and long term care and chronic conditions are also covered. The policy's provisions are all decided by by the government. Now, I'm going to show you an actual policy. This is my policy. It's for a 61-year-old male, and you can see that the premium is 166 euros, which is $181. And there is an annual deductible of $421. Now, you don't have to pay this all at once. When the insurance company receives a bill from the hospital, they will send it to you, and then you have to pay it then. But you can pay it in 10 separate payments, and these payments are interest free. And if you go to the maximum, your payment will be $42.10 a month. Pretty affordable by everybody. There is a 25% copayment. A lot of treatments are 100% covered, but some treatments have a copayment. And these copayments count towards your deductible. So once you reach your deductible, which this past year was 385 euros, $421, then anything over that you get covered 100%. My policy has a dental supplement, and that gives me 2 free checkups every year and up to 500 euros worth of dental work. The supplement also has a physiotherapy coverage, 12 sessions a year. Actually, that has gone up to 27 sessions per year, I think. And you also get 350 euros per year for alternative care such as acupuncture. All children under 18 are free, and they're covered under parents' policy for no extra charge. These are private companies, and there's very, very strong competition because every year you can change your policy. And since there's no exclusion for pre existing conditions, they have to take everybody. So the competition for premiums are pretty severe. The way a lot of politicians and other people talk in the United States, and I've heard Bernie talking about European health insurance, and Bernie, we love you so much over here, but you need to talk about specifics because you keep going along with this story that it's all free and it's all free, but you see, you can have private insurance companies and also very, very affordable premiums. I know the premiums that I'm paying here is would be considered ridiculous for a 61-year-old in the United States, but this is my premium. There's actually lower premium policies, some of them in the 90 euros per month category, which is really basic and doesn't cover dental and some of the other extra provisions I have on mine. But it's really, really affordable. And if you have low income in the Netherlands, the government will supplement up to 60% of your insurance premium. So it's very, very affordable. This system is really, really workable. The insurance companies make a bundle of money, hospitals make a bundle of money, and everyone has excellent care. So it's not a matter of choosing between a capitalist system and a free system. You know, the United States, it's really, really about a lot of extremes. And the truth is that there's a compromise here. And our system really, really works. And I think the United States, the health insurance issue has become too politicized, and it's not good for the citizens, and especially citizens who have low income. And health insurance should be a human right, and it shouldn't be just something that people with money can afford. Okay? And actually, health insurance and people being treated for minor illnesses saves the country a lot of money, because when things don't get treated, they get worse and worse and worse, and then the treatment becomes very, very expensive, and then there's loss of time from work and lower productivity. And many, many studies have proven this. So we need to get health insurance out of politics and get it into the real world. Because in the real world, health insurance really, really works.